Okay, so I would start off by performing hand hygiene, and then I would go into introducing myself. So, hi, my name is Becca. I'm a student at Marywood University, and today I'm going to be conducting a neurological exam. Can you please tell me your name and date of birth?
Laura Little, 11/17/34.
And do you know who the president is?
Donald Trump.
And do you know where you are?
At the doctor's
And why are you here today?
for a neurological exam.
Okay, so the patient is awake, alert, and oriented ×4. And as you can see, the patient's appearance and posture and behavior is good, and her memory and comprehension and attention span is also good. So I would move on to testing the cranial nerves, starting with cranial nerve number 1, which is the olfactory. So I would have the patient close her eyes and occlude one nostril. So occlude one nostril. And I'm going to have her identify a scent.
Coffee.
And it is coffee. So I would move on to testing. Then I would move on to testing cranial nerve number 2, which is the optic nerve. And this is usually conducted while performing an eye exam using an ophthalmoscope. Unfortunately, I don't have one on hand, but you would put the scope to your eye and find the red reflex and follow it in toward the patient's eye, looking at the optic nerve in the disc. And cranial nerve 2 is also involved with pupillary reaction, so you can also test it by assessing the constriction of her eyes. Okay, and both pupils are equal, round, and reactive to light, and this can also be used to test cranial nerve number 3. And then moving on to test cranial nerve number 3, 4, and 6. They're all involved with eye movement, so I'm just going to have the patient follow my finger with her eyes. Okay, good. And then moving on to cranial nerve number 5, which is the trigeminal. Cranial nerve number 5 is both sensory and motor function. So to start off with the motor aspect, I'm going to place my hands on your cheeks, and I'm going to have you first start off by clenching your jaw, and then go ahead and open and close your jaw. Okay, good. And then for the sensory aspect, I'm going to have you close your eyes and identify if an object is sharp or dull. And this can be used by breaking off a Q-tip in half.
Sure.
Okay, good. And then we can move on to assessing cranial nerve number 7, which is the facial nerve. So I'm going to have you puff out your cheeks for me, and then smile and frown. Okay. And then for cranial nerve number 8, which is the acoustic, this deals with hearing. So I'm going to include one of her ears at a time and whisper a common word, and then I'm going to have her repeat it back to me.
Banana.
Okay, and then you would do it with the other side as well. And then moving on to cranial nerves 9 and 10, which are the glossopharyngeal and the vagus. I'm going to have you go ahead and swallow for me. Okay, and then I would take a pen light and watch the patient say ah. Ah. Okay, and her uvula is midline. And you could also test the patient's gag reflex for this as well. And then moving on to cranial nerve number 11, which is her spinal accessory. I'm going to have her shrug against resistance and then turn her head against resistance. And then that brings us to our last cranial nerve, which is cranial nerve number 12, the hypoglossal. And I'm going to have you stick out your tongue all the way. And as you can see, it's midline. And then I'm going to have you move your tongue from left to right. All right, good. And then we're going to move on to the motor part of the exam. So I'm going to start off by testing the Romberg test. I'm going to have you stand up for me with your feet put together. And I'm going to have you stick your arms straight out with your palms facing upward and close your eyes for me. And as you can see, there's no loss of balance or swaying, so she passed. And I'm going to conduct a finger to nose test now. So I'm going to have her touch your nose and then touch my finger and then touch your nose again. Now, if the patient had a brainstem problem, she wouldn't be able to do this. And so we can move on to the heel and shin test. I'm going to have you run the heel of your foot against the opposite leg. And then do it to the other side as well. Good. And you can go ahead and sit down again. So we're going to move on to the sensory part of the exam now. And we can start off by doing the stereogenesis test, where I'm going to have you close your eyes and I'm going to put a common object in your hand and you're going to identify it for me. So go ahead and close your eyes and stick out your hand. And go ahead and feel it and try and identify it.
Quarter.
Okay, and it is a quarter, so that's good. And then we can move on to the graphesthesia test, and I'm going to have you close your eyes, and I'm going to write a number in your hand, and you're going to say it back to me.
3.
Okay, good. So the next part of the exam is the testing the deep tendon reflexes. So unfortunately I don't have a hammer to test them, but I'll walk you through them. So the first one you're going to do is test the brachial radius, and you're going to hold the patient's midarm and you would strike the hammer on your thumb and it would cause the patient's thumb to twitch. And then you can test the biceps, where you're going to hold the biceps and you would strike the hammer on your thumb again, and again it would cause the patient's thumb to twitch up. And then you can test the triceps, holding an arm like this, and you hold just above the elbow, and again you would strike your thumb and her arm would most likely shoot out like this. And then you could test the patella, so you would strike right below the patella where the depression is, and her leg would fling out. And then lastly you would test the Achilles, and that is right behind the ankle here, and you would strike it with a hammer and her foot would flick. So for the next part of this exam, you'd have your client lie down to perform a range of tests. We can start off by first performing the plantar reflex, or the Babinski sign. So to do that, you would take the patient's foot and you would stroke from the heel up to the toes. And you should notice flexion of the toes, but it's abnormal for the toes to fan out. You can also do the Koenig sign, which is where you would flex the client's legs at both the hip and the knee, and go ahead and straighten your knee. Any pain?
No.
Okay. No pain should be noted. If it's noted, it could be indicated of meningeal irritation. And you could also do the Babinski sign. So I'm going to have you flex your neck. Is there any pain noticed at your hips or your knees?
No.
Okay. And no reaction should be noted, and no pain should be noted on the hips or the knees. And if it is, it could be indicated of meningeal irritation as well.